Okay, so now we'll talk about the muscles of the trunk. This part of the body is called the trunk. So we'll see the anterior trunk muscles and then about the posterior trunk muscles. Okay, so first let's see the anterior trunk muscles. So this is the largest muscle of your chest. That means the front of the upper part of the trunk. This is called pectoralis major. So these two are pectoralis major. Pectoralis means chest, major means the main one. Okay. Now if you remove this pectoralis major, under the pectoralis major you will see a smaller pectoralis muscle that is called the pectoralis minor. Okay, and these muscles help you to flex the shoulder and also rotate the arm medially like this. Okay, so rotate the arm medially and adduct, that means moves the arm towards the trunk. So adduction as well as rotation, medial rotation, okay, and flexion of the shoulder. Now pectoralis major, and under this you have pectoralis minor, and also under this muscle you have the intercostals in between the ribs. Okay, there are two sets of intercostals. They help in breathing. External and internal intercostal muscles. Inter means in between, costal is rib, so in between the ribs. So only pectoralis major you can see here. You don't see the pectoralis minor. You don't see the intercostals. Then you see these muscles here. These are called serratus. Why these are called serratus? Because anterior end of this muscle splits and get attached to the ribs, like end of or edge of saw. And also you have probably seen the serrated knife that splits like this, the knife. Serratus anterior. Okay, and then if you see the back, this is the back of the trunk, and this muscle, the largest muscle in the back of the trunk, it goes like this, diamond shaped or kite shaped muscle, that is called the trapezius, trapezoid shape. And you remember when I showed you the half head, I told you the upper part of trapezius is in the back of the neck. Okay. Then you have another big muscle. This is called the latissimus dorsi. Latissimus dorsi. Dorsi means back, dorsal. Okay. And then you have the infraspinatus, below the spine of the scapula, infraspinatus. Under the trapezius you have two other important muscles. Those are pretty big too. Rhomboideus major or rhomboid major and rhomboideus minor or rhomboid minor. These muscles are named after their shape. Trapezius, named after its shape. Rhomboideus, rhomboid shape. There are two. Major is the bigger one, minor is the smaller one. You don't see them because they are under the trapezius. Okay, so let's quickly go over. These are pectoralis major under the pectoralis major you have pectoralis minor, and also in between the ribs you have external and internal intercostals, okay, and serratus anterior, serrated muscle, okay, serratus anterior here. And then in the back you have this large kite shape or diamond shaped, that is the trapezius, trapezoid shape, and this is the latissimus dorsi. And under the trapezius you have rhomboideus major, rhomboideus minor, and this is called infraspinatus muscle, okay. And then this one is a shoulder muscle, this is called the deltoid. You know that we give shot or injection into this muscle, we use this muscle. Why it is called deltoid? Because of its triangular shape, delta shape, okay, deltoid, attached to the side of the upper part of the arm. So when this muscle contracts, it will abduct the arm. Abduction means moving away from the body or trunk, okay. So always remember, the muscle moves the bone towards it. So this muscle is this way, so it will move that way towards it, okay. If the muscle is here, we'll move towards it this way, okay. So those are the muscles of the upper part of the front of the trunk and the back of the trunk. Now we'll talk about the abdominal muscles, the lower part of the trunk. In the lower part of the trunk you have 4 muscles. 2 of them you can see here, okay, and other 2 are deeper muscles. So first, in the middle of the abdomen, this straight muscle is called rectus abdominis. Rectus means straight and it is in the abdomen, abdominis. So this is rectus abdominis, located in the middle of the front of the abdomen. And this muscle gives you 6 packs. This is separated by connective tissue sheet. And this connective tissue sheet that goes straight down through the middle of the rectus abdominis, this white connective tissue structure is called linea alba. So this is linea alba, okay. And then another muscle that you can see from outside, superficial muscle, this is called the external oblique or external oblique abdominis. Why this is called external? Because it is the outer muscle, external muscle. Oblique, why? Because it is, you see, the fibers are like this, not transverse. This way is transverse, this way is rectus, straight, right? It is not transverse, not rectus, in between, okay. So external oblique. Now under the external oblique you have another oblique muscle that is called internal oblique. The fibers are also oblique, but this way, okay. So this way. So external oblique, fibers are this way. Internal oblique, under that fibers are that way, okay. Then another muscle of the abdomen is under the rectus abdominis. If you remove this, you will see a muscle, the fibers are going like this, transversely. So that is called transversus abdominis, okay. So 4 muscles. This one is what? Rectus abdominis, straight, external oblique. Under the external oblique you have internal oblique like this, and under the rectus abdominis, transversus abdominis. The fibers are transverse like this, okay. And the abdominal muscles help in a number of functions. One is forceful breathing. when you breathe forcefully, you use the abdominal muscles. Abdominal muscles help you to increase the intra-abdominal pressure, and that increased intra-abdominal pressure helps you to defecate, to urinate, to uh, vominate. So those functions are screaming, childbirth, parturition. All those functions are helped by the abdominal muscles, because by contracting the abdominal muscles you can increase the pressure inside the abdomen. Okay, so those are the trunk muscles. Okay, okay everybody, so now I'll show you the muscles of your upper limb. So this is your upper limb. So first I'll show you few muscles of your shoulder around here, then I'll show you the muscles of your arm, and then the muscles of your forearm and the hand. So this is a large triangular muscle located laterally in the upper part of your arm, and this muscle is called the deltoid. It is delta shaped or triangular shaped muscle. You know, most of the time we get shot or injection, intramuscular injection here. Okay, so this is the deltoid, and since it is attached to the side of your upper part of the arm, it will cause the abduction of your arm. Take the arm or moves the arm outwards, away from the trunk. Always remember, the muscle moves the body part towards it. So muscle will move towards it. So this muscle is attached to the side, so it will move that way, okay, towards it. And another important thing is that the muscle works on the part below it in most of the cases. So this muscle comes from the shoulder and works on the arm. So works on the area or part below it. Okay, so it will move the arm laterally. That is called the abduction. Okay. Now, if you see the back of the shoulder, let me take off the deltoid. This bony structure is called the spine of the scapula. You should remember this spine in the back of the scapula or shoulder blade. So above the spine, this is called supraspinatus. Supra means above. Below the spine, this muscle is called the infraspinatus. Infraspinatus has a number of bands. And then below the infraspinatus, this muscle is called the teres minor, and this one is called the teres major. So four muscles here in the back of the scapula: supraspinatus, infraspinatus, teres minor, teres major. Okay, and they help to move the shoulder. Since they are attached to the back, so they will move the shoulder backwards. Okay, and now the front of the scapula, this big muscle is called subscapularis. Subscapularis. Okay, and now let's see the muscles of the arm. This is the front of the arm. In the front of the arm, you have biceps brachii, B-R-A-C-H-I-I. And why it is called biceps? Because if you see the upper part of this muscle, it has two heads. This is called the long head of biceps, and this is called the short head of biceps. Okay, and since it has two heads, it is called bi. Bi means two. Biceps brachii. This is the brachial part. Arm area is called the brachial area. So all these muscles in the arm are named after brachial. So biceps brachii, and under the biceps brachii you have another big muscle. You can see here, this one. If I take off the biceps, you can see more clearly the whole muscle. This one, this is called the brachialis. Okay, so you see all the names come from the brachial, and these two are the large muscles in the front of your arm, and they will do what? Again, they will move the part below them. So which part is below them? The forearm, right? And towards them, that means the flexion of the forearm. Okay, so we'll work below them and we'll move towards them. Flexion of the forearm. This is the flexion of the forearm. Okay, and this is extension. So now let's see the back of the arm. So this large muscle in the back of the arm is called triceps. Why it is called triceps? Because it has three heads. Okay, this one is the lateral head, this one is the long head, and this one, smaller one, is called the medial head. Okay, so three heads of triceps. Tri means three, and since it is in the back, it will do what? It will cause the extension of the forearm. So this is the flexion and this is extension. So the back muscles here, the back muscle triceps will move towards it, extension, and biceps and brachialis will move towards them, flexion. Okay, now let's see the muscles of your forearm. So this is the forearm, and first we'll see the front of the forearm, which is called the flexor or anterior compartment. Why these muscles are called the flexors? Because you see these muscles go to the hand and fingers and work on the hand and fingers, and we'll do what? We'll move the hand this way. So that is the flexion of the hand, and this is the flexion of the fingers. So the muscles going down from the front will work on the hand and cause the flexion of the hand, and also some muscles will cause the flexion of the fingers. Okay, so that's why these muscles are called the flexors. And in the back of the forearm, this is posterior compartment. These muscles are extensors. Why? Because they go to the back of the hand and back of the fingers. Some of them go to the back of the hand, some of them go to the back of the fingers. So we'll do what? We'll do the extension of the hand and extension of the fingers. Okay, so this is the flexion of the finger, flexion of the hand. This is the extension of the finger, extension of the hand. Okay, so muscles always pull towards them. So first, let's see the flexors or anterior compartment muscles. This big muscle you see here, this one is coming down from the brachial part or arm. So this one is called brachioradialis, going to the radial side. This is the thumb, lateral side is the radius here, the bone. So this muscle is called brachioradialis, coming from the arm and going to the radius, brachioradialis. Okay, and then you have a small muscle here that is called the pronator teres. Okay, and then this muscle. Okay, this one is a flexor since it is in the front, so it is called flexor. carpi radialis. Why radialis? Because this is the radial side, thumb side, and flexor is the function, flexion. So flexor carpi. Why carpi? Because going to the wrist bones, carpals. So you see the names are actually easy to remember. This is anterior muscle, so flexor, and going to the carpal bones, that's why carpi, and this is radial side, radialis. And then in the ulnar side, this one is flexor carpi ulnaris, and in between these two, this one in the middle is called palmaris longus. Why this is called palmaris longus? Because the lower end gets attached to the palm. Okay, so palmaris longus. So those are superficial muscles of the anterior compartment of the forearm. I am repeating again. This one coming down from the brachial part. So brachioradialis, then pronator teres, then flexor carpi radialis, flexor carpi ulnaris, and in between palmaris longus. Okay. Now, if you see under the palmaris longus, this is another big muscle actually. This muscle is called flexor digitorum superficialis. Why it is called flexor digitorum superficialis? Because from the lower end, tendons, the white structures here you see, tendons go to the digits or fingers and will cause the flexion of the digits. Okay, so that's why it is called flexor digitorum, okay, superficialis. And then you also have deep muscles. This one is called flexor pollicis longus. Just think that. Why? This is the thumb, also called pollis. Okay, so this muscle will go here to the pollis because this is flexor pollicis longus, and the tendon goes like this here. From the lower end of the muscle, this tendon goes to the front of the thumb, and when this muscle contracts, it will do what? Will cause the flexion of the thumb. That's why it is called the flexor pollicis longus, and this is the tendon of the flexor pollicis longus here. Okay, and digitorum profundus. The tendons of this muscle go to the digits. Okay, so flexor digitorum profundus. So let's go back again to the anterior muscles quickly. Anterior forearm muscles. So this is brachioradialis, this is pronator teres, this is flexor carpi radialis, flexor carpi ulnaris, in between palmaris longus. Under the palmaris longus, this big one is flexor digitorum superficialis. The tendons go to the digits, okay, and will cause the flexion. Then the deep muscle here, this is the flexor pollicis longus, goes to the pollis, front of the pollis or thumb. Okay, and this is flexor digitorum profundus. Okay, so there are two flexor digitorum. This is superficialis under the palmaris longus, and this is profundus, is the deeper one. Okay, so these are the muscles work on the hand and fingers or digits and cause the flexion of the hand and flexion of the digits. Now let's go to the back. Posterior muscles are the extensors, right? So let's see the radial side. So this is radial side, thumb side, right? So this is This is extensor carpi radialis. Then this one, big one in the middle of the back or posterior compartment, this is called the extensor digitorum. You see the tendons go to the back of the fingers and will cause the extension, will move towards them. Okay, so extensor digitorum, this muscle, and these are the tendons going to the back of the digits. And then you have the extensor carpi ulnaris, because this is the pinky side, ulnar side, so extensor carpi ulnaris. Okay. Now, if I see the deeper muscles here, you see these two muscles, they are going this way and the tendons are going to the thumb pollice. So one is going to the back of the pollice, that will cause the extension of the pollice. So extensor pollicis longus, and another one is getting attached to the side of the pollice and will cause the abduction of the pollice. So see here, this is the flexor pollicis, goes like this, cause the flexion of the pollice. Extensor pollicis like this, causes the extension of the pollice, and abductor pollicis, abduction of the pollice. So here you have the extensor pollicis and abductor pollicis. Okay, so those are the muscles in the back of the forearm. Here you see the muscles in the thumb side of your hand, these small muscles, these are called the thinner muscles of your thumb, thinner muscles. Okay, and those are the muscles, important muscles of your shoulder, arm, forearm, and hand. Okay, so let's quickly go over again. So here, this is the shoulder. So this triangular muscle attached to the side of the upper part of your arm, this is called the deltoid. And then above the spine, this is called the supraspinatus. Below the spine, infraspinatus, it has a number of bands. And then teres minor, teres major. So those are in the back of the scapula. Okay, and the front of the scapula, this is whole muscle, big muscle, is called subscapularis. Okay, then the muscles of your arm, this is the front of the arm, so this outer one is the biceps brachii. Then under the biceps brachii, this is the brachialis, and in the back you have triceps brachii, 3 heads, lateral head, long head, medial head. Okay, and then let's see the anterior or front of the forearm. The anterior compartment muscles cause the flexion of the hand and flexion of the fingers. Okay, so this is called the pronator teres, will cause the pronation of your hand. This is called the pronation. This is supination. Okay, so pronator teres, named after its function. Okay, then this is the brachioradialis. This is radial side, thumb side, which is the lateral side. So that is flexor carpi radialis. Then flexor carpi ulnaris, pinky side. In between, palmaris longus. Under the palmaris longus, this one, big one, is called the flexor digitorum superficialis. Okay, the tendons go to the digits. Okay, and all these are flexors. Now let's see the deeper muscles. This muscle is called flexor pollicis longus. Why? Because the tendon goes to the pollis, thumb, and causes the flexion of the thumb. And this one is called flexor digitorum profundus. We'll go to the digits. Now let's see the extensor compartment or back. Okay. Again, first you will see which side. This is thumb side, that means the radial side. Okay. This is the extensor carpi radialis. Okay. And then this is the extensor carpi ulnaris. And in between this big muscle, in the middle of the back of the forearm, you see the lower end forms tendons, and those go to the back of the fingers or digits. So this muscle is called the extensor digitorum. Okay. And then these two muscles go to the pollis or thumb. Okay. One is the extensor pollicis longus, another is abductor pollicis longus. So one will do extension, another will cause the abduction. Okay. And then these are the thinner muscles of the thumb. So those are the muscles of your shoulder and arm. Okay.